lot of body parts, hips, wear out. But getting a hip replacement is a little scary because it takes so long to recuperate. Well, now there's an alternative. In tonight's 9 p.m. Extra, a less invasive procedure getting some patients back on their feet in no time.
In the work that I do, I really felt it was important for me to get back quickly.
Jack White wasn't going to let getting his left hip replaced put him on the disabled list. The 71-year-old is a personal trainer at the YMCA in Scottsdale.
5 days after surgery, I walked 1.5 miles without a cane.
A speedy recovery due to a minimally invasive procedure Jack says he did 2 years ago called the anterior hip replacement.
It allows patients to leave the hospital faster. Where traditionally patients were staying in the hospital 3 or 4 days, we have a large percent of our patients leaving even the next day.
Dr. Michael Domer is with Arizona Orthopedic Associates. The procedure is done using a state-of-the-art operating table called the OSI ProFX Hip and Knee Arthroplasty.
With the table, we can basically put the hip and the leg in any position that we want to.
This positioning of the leg gives surgeons the ability to replace the hip through a single incision without detachment of muscle from the pelvis or femur.
The traditional ways of doing the hip surgery are either from the side, which is a lateral approach, or from the back, which is a posterior approach. Both of those procedures involve cutting muscle and doing some extensive detachments, which leads to prolonged hospital stays and prolonged patient recovery.
With the anterior hip replacement, most patients will not only see a faster recovery time, anywhere from 2 to 8 weeks, but less pain and low risk of dislocation.
It allows us to do it safer with smaller incisions, and I personally like using the table because it allows me to get x-rays during the procedure, which allows me to ensure that my components are positioned properly.
After 4 weeks, I was doing so well, I was virtually pain-free, and he let me teach my aerobics class, and I played 18 holes of golf.
Jack is definitely still going strong today. He's not only continuing to keep his clients in shape, but he's still very active himself, which includes running 6 miles a week.
And looking at the overall recovery thing, I was just kind of going at my pace. I didn't have any targets.